A warning, this podcast discusses suicide.
A new report card from UNICEF has New Zealand as the lowest ranking country for child mental health.
It was a scathing report.
Pretty grim reading if you're talking about youth suicide in New Zealand compared to the rest of the world.
With the second highest rate of children experiencing bullying.
Confirming what those on the front line already knew.
In just the last year and a half, I've seen the decline in mental health in our rangatahi, and we work with most vulnerable, Decile 1 schools throughout the country, and seeing these kids come to school not even ready to learn, that's alarming.
The report came out last Wednesday, and it was the shocking figures on our youth suicide rates that drew the most attention.
Pre-COVID, we had a rate of 14.9 per 100,000 people. This is for 15 to 19-year-olds. After COVID, it increased to 17.1, which means we were the highest in the developed world and almost 3 times higher than the average for high-income countries.
3 times higher than the average. If that seems unbelievable, well, for good reason. 2 researchers from the University of Auckland claim that stat is wrong.
This is our whole world, this research, so we know what the data look like for New Zealand. We're constantly looking at it, so we just knew when we saw it that it wasn't correct.
In UNICEF's defence, they've used the best data available, but our confirmed statistics are so far behind, it's making us look bad. Kia ora, I'm Davina Zimmer, and today on The Detail, the real youth suicide rate and the danger of misleading headlines.
There are some consequences of our well-intentioned coverage of these types of reports, because it makes young people and whānau and the community in general feel like that suicide is all around, and it makes people feel quite hopeless.
That's Associate Professor and Director of Population Mental Health, Sarah Fortune. We're sitting in an office at Auckland University's Grafton campus with Sarah Hetrick. She's an Associate Professor in Youth Mental Health.
One of the things that struck me immediately as well when I looked at the report, and it relates to thinking about young people in all facets of their lives and their well-being, is the way that there were just 2 indicators of mental well-being in that report, one of which is suicide. Now, we would very strongly say that whilst mental health can be a contributor, that the 2 things are not equivalent. So there are many, many, many more things about a young person's life and the environment in which they live that impacts on well-being and is an indicator of well-being. And I would point to things like the Youth 2000 series of data to look at a number of different indicators of youth well-being in this country, some of which indicate things have improved over time, actually. So for sure some things are not as good as they were, but some things have improved. So I think there was a fundamental problem even with using suicide data as an indicator.
And then there's the way that UNICEF calculated their data on youth suicide. The report says they've used the 3-year average for 2018 to 2022, or the most recent 4-year period available. UNICEF Aotearoa told us that, quote, the report uses 3-year averages to smooth fluctuations and therefore calculates New Zealand's average using data from 2018 to 2020, which is the last period for which confirmed data relating to the age group in question was available, end quote. Other countries that had more recent data, like Australia for example, had their averages calculated using figures from 2020 to 2022. Back in the Auckland Uni campus, the Sarahs are explaining to me why this data is misleading. They're showing me the suicide data web tool created by the Ministry of Health and the Ministry of Justice. Here's Sarah Fortune.
What these data represent are an estimate of how many people have died by suicide each year. And in New Zealand, what happens is that if there is an unexpected death, that's initially attended by the police, and then the police notify that event to the coroner. And then in New Zealand, the coroner takes jurisdiction over these unexpected events and decides under the Coroner's Act, so according to the law, whether this death was self-inflicted
And secondly, was that in circumstances in accordance with the legal test of what is suicide? That's why we've got two types of data that are shown up here. The first one is called confirmed deaths. So that tells us that the circumstances of that person's death have been reviewed by the coroner and have been recorded as being a suicide death. And then we have suspected cases, which indicates that that situation is still open to the coroner, and the coroner is making every effort to collect as much information as they feel that they can to make a decision about that.
The tool has a couple of options of how to view the data. Sarah Hetrick selects View by Age, so we can look at the specific data on the 15 to 19 age group, the group that was analysed by UNICEF. She also filters the figures by calendar year instead of financial year.
Because the figures will look different depending on whether you're looking at a financial year or a calendar year, and that's partly about reporting. So Sarah talked about what we call suspected suicide, so that's before the coroner has made a finding, and those data are released annually. They are calculated for a financial year. Whereas confirmed suicide data, so when the coroner has made a finding, they wait until a whole calendar year has been complete. And what you're looking at here is the graph. You can see the data go back to 2009 on this tool. That solid line is the line representing those deaths that have been confirmed.
The y-axis here is the rate per 100,000. And that's really important because populations change. So say you live in a village and there's 100,000 people and you've got one red-headed person.
Yeah.
And then you go back the next year and you see two red-headed people. You might think, the number of red-headed people has doubled. But in actual fact, if something miraculous has happened in your village and it's gone from 100,000 people to 200,000 people, you have the same rate. One per 100,000, one redhead per 100,000 in the first year, and then the second year you've got 200,000 people, but you've got two redheads. Right. So the rate is still one per 100,000.
Right, so we're looking at the rate.
We're looking at the rate. You can see I've selected rate there. And this is the confirmed line, the solid line. This line here is suspected self-inflicted deaths. We call them suspected suicide.
So they're unconfirmed.
They are unconfirmed.
So that's the dotted line.
Yeah. You can see that those lines follow very closely. So there's not usually very much of a difference between the confirmed and the suspected rate. That's important because the UNICEF report goes up to 2022 and we don't have confirmed data.
But we do have suspected suicide data. That data says in the financial year 2021 to 2022, the rate was 12.3. The most recent that we have from 2023 to 2024 says the rate was 11.8. And like Sarah Hetrick said, the confirmed rate tends to follow the trend of the suspected rate. As a reminder, UNICEF used averages of confirmed data to come up with their figures, and that's not necessarily wrong. Averaging out figures to, quote, smooth fluctuations isn't uncommon. Both Sarahs say there's more to gain from looking at long-term trends instead of individual years. But in this case, the issue is that the average quoted in the UNICEF report seems to contradict what our suspected data is saying.
In actual fact, suicides went down in our pandemic-affected period.
Well, I'm looking at the lines now, and there's actually, aside from that slight increase there between 2020 and 2021, it's actually a downward
trend. Yes. And we, along with colleagues led by Jane Purkis, Professor Purkis at the University of Melbourne, have done a large international comparison of the deaths by suicide in the pandemic-affected period. And those two studies show that in the vast majority of countries for which data were available, that the suicide rate either did not change in the pandemic period or it went down. In New Zealand, it looks like in Aotearoa, our data, deaths by suicide, went down, and it went down across all age groups, and there was a real 20% reduction in each of those years.
Sarah Hetrick says the danger of this report is that it promotes headlines and discussion about declining youth well-being and contributes to a hopeless narrative that isn't helpful for youth who are struggling.
You know, young people are hearing that. I don't know what they make of that. And then we're pairing it with incorrect, judging on this, information about suicide. And I think the risk is that young people particularly will hear wellbeing's not going so great and suicide's going up, and pairing those two things together as though somehow suicide is an inevitable consequence of poor wellbeing is a very dangerous message, because suicide is not inevitable. You know, we spend our lives thinking about the incredible resilience of young people, talking with them about what is making their lives better and what interventions we can create with them to ensure that the world they live in is a world in which they can flourish.
The UNICEF report determined the overall well-being of children across the globe by analysing 6 factors: life satisfaction, youth suicide, child mortality, weight, academic proficiency, and social skills. The goal across the board is to improve child wellbeing and prevent suicides. But Sarah Fortune says doing that goes beyond improving just these 6 measures.
Myself and colleagues in the Suicide Mortality Review Committee and the Child and Youth Mortality Review Committee, along with Ngāpō Arowhenua, have published a very comprehensive report called Te Māori, and that looks at rangatahi deaths by suicide over nearly a 20-year period. And what that report highlights is that the factors that need to be improved to prevent suicides in New Zealand amongst young people relate to much more structural determinants. So exposure to violence, especially sexual violence, exposure to harmful consumptions, particularly of alcohol, being excluded from school. And yes, some of those young people could have been described as having a mental health concern, but that's not the strongest message that comes from our review of those very precious young people who are now gone from this world. The other really important thing for us to focus on and remember is that, tragically, the vast majority of deaths that we have in New Zealand by suicide in these younger age groups are deaths from our Māori community. So when we say we have the highest youth suicide rate in the world, what that really means is we have one of the most inequitable outcomes for death amongst our Māori young people.
What's the benefit of these global reports then, if the solution is so individually tailored, even down to the individual person who's suffering? What's the benefit of knowing our global ranking and comparing ourselves to international countries?
I mean, I think, as Sarah's alluded to, we have really good data in New Zealand. I've talked about Youth 2000 series of studies that they've done, the work of the Suicide Mortality Review Committee. So I think we risk missing what we know about our own place and space here in Aotearoa, New Zealand. And that's where I think we need to be looking and working together with young people and other stakeholders to address the issues that we have here.
But UNICEF Aotearoa's Tanya Suiki-Mead says these reports are useful.
In order to provide useful, comparable data between different countries to understand how children are doing on different dimensions of their well-being, it has to use globally comparable data sets. For the suicide data, that's the best, most confirmed data that we have in New Zealand, and for many other countries captured in this report, is for 2018 to 2020.
Do you not think that that is unfairly unflattering for New Zealand?
No, not at all, because there are about a third of the countries who are captured in this report who have similar data sets where we have that confirmed data in that time frame. So multiple countries capture data in different ways, produce it and confirm it at different time frames. So in order to be able to make a useful comparison between countries, the report uses like-for-like data in order to make sure that there is a genuinely useful comparator about how countries are doing over that time frame. It also produces averages over a period of time so that it's not about potential fluctuations in data year to year, but looking at trends comparing previous 3 or 4 year reporting periods to current 3 or 4 year reporting periods with confirmed data. Our report is not attempting to paint a worse story than we believe exists. We are really keen to understand what the long-term trends are for youth suicide, to understand if what we are doing is working. And if that is the case, since 2020, then that is a hugely welcome improvement. Our intent with this report, that UNICEF Global's intent with this report, is to understand how New Zealand compares to other countries at periods of time. Inevitably, there will be a delay in the data, confirmed data that's available from New Zealand and indeed from other countries. And so with time, we will be able to understand if recent suspected declines in suicide data from New Zealand are mirrored or not mirrored in the declines from other countries, which will be a really important opportunity to reflect.
And just because parts of the report aren't as shocking as they looked, doesn't mean we don't have big problems.
I guess what we know, regardless of what the UNICEF report says, is that far too many young New Zealanders, children, are in struggle street.
Matt Reid, CEO of children's charity Barnardos, didn't need a report to tell him that the mental and physical health of more Kiwi kids is in trouble.
1 in 7 children living in households experiencing family violence. Increasing numbers of young children with mental health issues. It's a fairly consistent trend. We see it in our work every day. So Barnardos currently serves about 30,000 young people and their whānau every year. And we also operate an incredible helpline called 0800 WhatsApp that's focused on 5 to 19-year-olds, which we currently chat and talk to 13,000 young people every year. So across all of those different sorts of services, we see so much.
I want to talk a bit more specifically about the suicide figures.
Yeah.
Because when I saw New Zealand's rate being 3 times higher than the average, I thought, that's so high. There's no way that that's real. What was your reaction?
Similar to yours, deeply, deeply concerning. I mean, what a horrendous thought to think that young people out there across our beautiful nation are having those sorts of thoughts. So through our incredible helpline, unfortunately, we are seeing that increasing trend as well. And what we hear through WhatsApp is, well, firstly, more and more sort of younger children using the service. So 1 in 5 of the children that currently use the service is 12 years of age or under. And currently, about 11% of all of the calls and chats that we have through WhatsApp are referencing suicide. Now, that's deeply troubling, and that's an increasing trend that we've been seeing over some years.
What do you think's causing that trend?
I think many things. We've touched on a few of them in relation to some of the hardship that whānau are experiencing. I think there's peer pressures. Unfortunately, also confirmed in the UNICEF report was increased bullying, sadly happening across our nation. I think there's social media trends, there's breakdowns within families.
The reason why I raised the suicide figures was because it's shockingly high. But another reason was that there is a researcher at the University of Auckland who has actually found that these figures are incorrect. What's your reaction to that?
Well, again, what I shared is what we know through Barnardos, through our helpline in particular. So, we are definitely seeing an increasing trend of younger people calling us and an increasing reference to suicide. And when I say reference, this isn't young people saying we're going to do drastic things, but even if they're even suggesting it or thinking about it or asking about it, that's got to be of concern. Again, back to what I said about the rankings, this is one of the challenges when you're trying to put out a report that ranks you against other countries. From my perspective, just having one young person in New Zealand considering suicide is one too many.
Is it actually, because you're saying that you already know all these things, how much value are these reports actually? Should we be looking at these reports when they come out, or should we be actually listening to the people on the front lines who are seeing this, like your people at Barnardos?
A bit of both. I mean, absolutely. Number one message from me is we have to move away from just continually reporting on these ghastly stats and focus on meaningful change that's going to make a difference for the young people and their families across our nation. We have to work together with government, with iwi, with community, with business to make changes that are going to be meaningful to make a difference for these young people. Now, if I think about the ultimate ambition of having a target of 0, that's probably not going to happen in my lifetime, but we must work towards it. We must work towards a nation where a lot of the work that Barnardo's currently does doesn't have to exist. Got to find ways to come up with better solutions and better actions. We need a generational plan. We see too many 3-year strategies from government and other organisations. We've got to come up with a generational plan that has cross-party commitment that we all buy into as a nation and work towards.
One thing he is pleased to see being included in this year's budget is the Social Investment Fund.
Barnardo's has been considering social investment and social return on investment for many years, and we did some recent work in relation to our social work that basically showed that for every dollar the country invests in our core social work, there's an $18 social return on investment. Now that is phenomenal. And even if you cut that number in half, it's still a phenomenal result. That means future savings in, the bad outcomes around bad health, bad employment, justice system, etc., etc. Quality, early intervention, prevention work matters and makes a difference and can save us all a lot of money down the track.
Are there any countries that New Zealand can look to and think, okay, that is how we should be doing things?
Yeah, I think there's some Scandinavian countries that have done phenomenal work in these places, and I've actually had the benefit of spending a bit of time in some of those countries, just learning a bit about what they're up to. And I've got to say, and I'll reflect on Denmark in particular. I spent a bit of time with some community groups, with a large council, and some time in some of their, government organisations. And I walked away with that, and it's a bit of a phrase that you hear a lot. It takes a village to raise a child, and I walked away really getting that from Denmark. The responsibility for teachers, for example, to be reporting any issues of concern about a child. And that was a mandated responsibility. I was lucky enough to be in Scotland last year, and they're doing some incredible work in the care space. The government's and their system's commitment to what they've called the Scottish Promise. And this was a long-term promise made by political leaders across different parties to meaningfully make a meaningful difference for the young people that were experiencing care, with the ultimate ambition of preventing care from being needed.
A final word from Sarah Hetrick.
I don't know whether reports like that have a solution focus in a way that is going to drive us as researchers, as community members, as a government towards the things that we can actually do to make a difference. I'm always a huge advocate of youth voice and working together with young people. They actually are navigating this world. We're old. We've aged out. We can provide some guidelines. We can certainly, as researchers, if it's research we're talking about, we can provide the research expertise. But young people know the world that they are facing and the difficulties they have and the solutions. So I think we need to be giving young people the dignity of citizenship in all the spaces that they exist in, all the environments that they're in, and working with them, not reporting about them.
That's all for today. The Detail is a newsroom production supported by RNZ and New Zealand On Air. Thank you to Sarah Hetrick, Sarah Fortune, Tanya Sawiki-Mead and Matt Reid. This episode was produced by Gwen McClure and engineered by Alex Harmer. I'm Davina Zimmer. Ka kite.